Dr. Denise C. Park, Professor of Behavioral and Brain Sciences at the University of Texas at Dallas and Director of Research at the Center for Vital Longevity, writing for the Washington Post, reported, "Older people say what they fear most about their future is a diagnosis of Alzheimer's disease." Dr. Park explained Alzheimer's is a progressive brain disease characterized by increasing forgetfulness and confusion, eventually resulting in loss of independence and ultimately loss of self. Early diagnosis does not make Alzheimer's easier to treat. Dr. Park said at this time there are no effective treatments to prevent or slow Alzheimer's disease, so there is no clinical advantage to an early diagnosis. Most people believe the first or early sign of Alzheimer's is memory loss. Dr. Park said there is growing evidence Alzheimer's disease begins its attack on the brain many years before memory-related symptoms appear. Researchers suggest there is a syndrome called preclinical Alzheimer's disease with amyloid protein as one of the earliest markers for Alzheimer's. 20 to 30% of healthy adults over age 65 with no memory symptoms have evidence of amyloid deposits. Until recently, a definitive diagnosis of Alzheimer's disease required a pathologist to examine brain tissue from an autopsy to find the sticky amyloid deposits and remnant tau tangles associated with Alzheimer's. The diagnosis requires that there be an overabundance in the brain of two proteins, beta amyloid plaques and tau neurofibrillary tangles. Recently, however, researchers have developed tools to identify these amyloid deposits in living people via PET scans. Dr. Park said if a PET scan is negative for amyloid, Alzheimer's can be ruled out. If it is positive and neuropsychological tests show abnormal memory and cognitive function, an Alzheimer's diagnosis is almost certain.